Dental implant failure is a real fear. I know I was terrified of it whenever I first started on my journey. But should you really be afraid? Is it really something to fear? We'll talk about it today. Hey, it's Danny yet again, and in today's video we are going to discuss dental implant failure. Should you really be afraid of implant failure? Well, I know in the beginning I was terrified, but I actually did my research and it turned out that it's actually something that you shouldn't really be that afraid of. What causes dental implant failure? Well, we'll go over some of that. To start off, whenever you first receive your implants, you're going to be on a soft diet. I know a lot of places will actually claim that you can go eat anything you want, and you probably can, and the chances of failure are pretty slim. But to go for a 3-month period, a quarter of the year, just to protect yourself, make sure everything heals correctly, make sure that the implants fuse to the bone is actually pretty crucial. The best way to think about it is you're going to sacrifice about 3 months of your life for the rest of your life. So it is very, very important to give yourself the proper healing time and to let everything adjust. You have just applied a new structure to your skull. You have just drilled screws into your skull. So you have to give this time to heal. If you don't, that can be the most common reason as to why your implants will fail. Now, you got to look at it like this. Many dental implants have a success rate of 92.1%. Traditional implants are around, on average, depending on what type of implant that you have, around 95%. So the chances of your implants actually failing are very, very slim. So the chances of this happening to you are probably not going to happen. But you do need to be aware of what you need to do and how you need to take care of your implants at the beginning. Implant failure in the beginning can be a few things. It can be deprived blood flow to the implant area. It can also be existing infection that wasn't fully taken out during your surgery. Now, this can linger on. You can leave a little bit of infection and then it can just all come back even after you got the mass amount out. So you do have to watch your doctor at this point. You have to make sure that you do your research and that you are going to an experienced doctor that does this a lot, that knows how to properly clean out your flap when you're opened and get every bit of that infection out. Also, another thing can be teeth grinding, moving the implants around. If you're one of those people that lay in bed every night and you're just stressed all the time and you're clenching your teeth, grinding your teeth, and you do this right away after your implants are placed, this can shift the implants and it can cause them to not fuse to the bone properly, and this will cause failure most of the time. So you do have to talk to your doctor about a bite guard or whatever you have to do to protect yourself against clenching or grinding. And this all goes back to not giving your implants enough time to integrate properly to fuse to the bone. So if you do go out and you're in the first week of having your implants and you're eating steak 3 times a day, you're biting into apples and eating popcorn and eating nuts and everything else that you shouldn't really be eating right away. And sometimes it's just really out of your hands. It can just be poor health of the patient. A lot of things, smoking, heart problems, there's so many different things that can just cause your body to reject the implants. So you do need to make sure that you're in proper health. Now, that doesn't mean that you have to be somebody that can go out right now and run a marathon, or even if you're disabled, as long as you got good general health. Now, things that can cause late implant failure can still be grinding and clenching your teeth. It can be bacteria getting built up by not cleaning around your implant areas and not properly using your water pick. You also have to be aware of bacterial infections and excess stress to your implants. So I know I mentioned a lot of things, but still in the end, the chances of your implants failing are really, really slim. So you really shouldn't worry about it, because the chances of it being you, like I said, they're extremely slim, and it's just adding more stress to you in an already stressful time. So thanks for joining me again today, guys. I just wanted to briefly go over dental implant failure. And if you have any questions for me, you need help with side hustles, ways to make money, finding a doctor, all that stuff, just email me. It's info@dentalimplantcouncil.com. I'll gladly help you out, and we'll see you next time.